Hi there, this is Dennis Velco with OutBüro. Thank you so much for tuning in to yet another episode of OutBüro Voices, where we have engaging conversations with LGBTQ professionals, entrepreneurs, and community leaders around the world. And oh yeah, great allies too. We're going to have a very informative conversation about the human papillomavirus, HPV as it's commonly known. And for that, we're speaking to the director and COO of the HPV Global Action nonprofit. We're chatting with Anthony and Teresa. Welcome to the show.
Great to be here. Thank you.
Awesome. Well, whomever would like to perhaps take the initial lead, let's just first do a kind of brief introduction of yourself and maybe a little bit of your background. And then we'll move into why did this Global Action Group get started? What was the kind of that spark? Because even starting a nonprofit, just like entrepreneurs, there has to be that passionate about something. So would love to get into some of that before we get into some of the more technical and informational issues.
Great. So my name is Teresa Norris, and I'm the founder and president of HPV Global Action. We've been a registered charity since 2006, and our name is very indicative of where we are in our trajectory of who we work with. We are really about global action, change, awareness about HPV, but it all started back when I was 23 and my best friend died of cervical cancer. And we grew up together, we had our kids together, and she had a diagnosis, and then 7 weeks later she died on my son's first birthday.
Oh goodness.
So it was incredibly tragic, I had a full career lined up for myself in a very different sphere, and I literally dropped everything. And me and her other best friend, we decided to launch an awareness campaign. The very next year on the anniversary, we did a run. And that was back in 2001 when she passed away. And HPV was really something that was not very well known. I'm not sure how much progress we've made with the general public so far, but it really led me to want to do something. And then the first fundraiser led to a second one. And then by 2005, I looked around the country in Canada where we live and saw that nobody was doing anything about HPV really on a large scale. So I decided to roll my sleeves up and found HPV Global Action. And now we are, really key in Canada for providing sexual and reproductive health information. We're all about being sex positive and inclusive, and base everything that we do on evidence-based education. So now my title is I'm a sexual health specialist, and I travel around the world and I do education stemming from as early as age 12 all the way through post-secondary and health professionals around the globe. And we're creating programs and sharing best practices around the globe. So that's just a little bit of a eyes view about, why I am in the business. It's a very personal I'm driven personally to do something about HPV. And we'll get into all the reasons why it's a good time to hear about it, because sometimes you hear about things and it's very overwhelming and it creates stress because you can't do much about it. But we're about to talk about something that there's a lot to do about it. So I'll stop there.
Okay. Well, Anthony, how about some of your info?
Hi, Dennis. Thanks so much for having us. I really appreciate you giving us the time to talk about such an important issue today.
Sure.
So I am the Chief Operations Officer for HPV Global Action, but my trajectory is very different. So I come from the world of education. I've spent most of my career teaching English as a second language and as a foreign language, which is what took me to Europe in the first place from where we're speaking right now. But I've always been in the sphere of LGBTQ plus activism and resources and information, which is why I met Teresa in the first place. So we have a very good friend, a sex doll in common, actually. What was his name again?
Sally and Joe are my sex
Sally
doll.
and Joe. So Sally and Joe are responsible really for why Teresa and I know each other, because they are the two dolls that Teresa uses in her presentation.
Okay.
So Well, that's where we met. So Teresa and I met where we were both holding a kiosk, an information kiosk. And we got to talking and we really hit it off. And after a while of not speaking and not meeting each other for a while, we formed a partnership with the two organizations that we worked with. And through that partnership, I started to get involved more and more with HPV Global Action. And then from that organization, I joined HPV Global Action as the Diversity Inclusion Officer. And so after all of these years of working as a volunteer in the community groups, Teresa and her team invited me to join full time. And when Teresa knocks on your door, you don't say no. You say, yes, Teresa, I would love to help. And so that's how I got started as Chief Operations Officer.
Okay, well, wonderful. Well, we have one thing in common. I also, after the U.S. Army, I was in Germany, 3 years active military, and then I helped open the very first technology call-in center for, my computers broke, my laptop is whatever broke for civilians and military in Frankfurt. And I was young, and my partner of the time and I started teaching English as a second language at a company that was, I don't know if it's still around anymore, but it was called In Lingua, very similar to like a Berlitz. And it was great. Part-time teaching English to, European nationals. I was making as much money doing that part-time as I was at my full-time job. So it was sweet.
Yeah, it's a cool job. It's a cool job. I enjoyed it. And yeah, it's very interesting.
So whoever would like to kind of start with maybe some of the baby steps into explaining, what is HPV, and whatever kind of typical path you go down in informing people about it and some of the issues surrounding it.
Yeah, I'll jump right in here. So HPV, as you mentioned, it stands for the human papillomavirus. We don't like to get too stuck on the long version of the wording, so we pretty much stick to it being HPV. And it causes 9 different types of cancers, and it causes genital warts. And the basics about it is that people come into contact with it when we are sexually active and doing anything sexually active below the waistline, which includes using your fingers and your mouths and any other body parts, even without penetration. So you don't need to stick your equipment into any hole. Just by skin-to-skin contact between the waist and the knees, front to back, anywhere where a bathing suit covers, we're coming into contact with HPV. And as much as condoms give a good protection against sexually transmitted infections, unwanted pregnancies, are also, an important reason why we definitely want to be promoting condom use. But unfortunately, it doesn't fully protect all of the areas that are, touching, because a condom only either covers the length of a penis or shields a vagina. So there's still that skin-to-skin contact. So no, we are not protected fully from HPV, even when we use a condom. So this is why over 75% of the world, everybody, we're not just talking about the United States or Europe or Canada, 75% of people will come into contact with one form or another of HPV in their lifetime. So when we're talking about, some people will say, oh, well, how will I know? Well, the first bad news is that condoms don't protect us from HPV. But the second bad news is that if a person with a penis has HPV, the only way they'll know is if they present with either an HPV-related cancer or genital warts. There is no test for people with penises to test for HPV. So in the large spectrum of tests, we can test for chlamydia, HIV, gonorrhea, syphilis, a whole list of sexually transmitted infections. But unfortunately, there is no technology that exists anywhere on the globe that will be able to detect HPV. So the only way somebody with a penis would know that they have it is if they were to present genital warts that usually look like small raised hard lumps that grow in clumps or alone. They may or may not cause itching, burning, or slight bleeding. And genital warts can be found anywhere from the waist to the knees, front to back of a person's body, or in the mouth. we're having a lot of oral sex, and how many of us are using dental dams and condoms when we're performing oral sex? Not very many of us, right?
No, not many.
Exactly. So we're ingesting HPV orally. So, the other thing is that even if we have an HPV, it can take many months or even years before these warts will appear. So what you did today, it may take several years from now before you look down at your genitalia or look in your mouth and see something. And we might be tempted to look at our current partner and be like, hey, look what you gave me. And then your current partner might show you their body part and be like, no, I don't have anything. You didn't get that from me. Well, here's the catch-22. You can still give HPV without having the physical symptoms of genital warts yourself.
Mm.
So you'll carry the virus kind of like in a knapsack, that you carry around with you. You'll give it to every person that you go below the belt with, but you might not actually get that physical symptom yourself. So the same thing pertains to because when we talk about HPV strains, they've been enumerated: HPV 1, 2, 3, 4, and it goes on and on and on. On the over 180 strains that exist, over 40 of them are linked to either genital warts or to cancers. So when we talk about cancers, some of the strains are leading to tonsil cancer, vocal cord cancer, tongue cancer, throat cancer, anal cancer, cervical cancer, vulvar cancer, vaginal cancer, and penile cancer. So, you might be thinking, oh, I have to have anal sex to get anal cancer. No, you do not. That's not how HPV works. It may present as an anal cancer or a penile cancer. Now,
if I can kind of interject here, it's like it was also, I brought this up in my initial conversation with Anthony. I just am awestruck that no tests have been developed for males. It just seems like, geez, they could create a, COVID test and COVID vaccines within this amount of time. And, with your being so close to this topic, have you heard of any of the pharmaceuticals who are in development? Because it seems like a really huge deal.
Well, so here's the thing. Biologically speaking, the way a penis, the biology behind how we'd have to access the cells to put them under a microscope and to take a look at what the person has, it's too evasive. It would be a full-on surgical procedure, and it's just not realistic. So it's not even about pharmaceutical companies. It's not about, when we're talking about tests in the world of healthcare, there's two sides. There's the solution side, which is pharmaceutical companies, and then there's the healthcare world that's into surgical, options and testing. And it's just too evasive of a procedure, and there'll be contamination of the cells. And it's just not something that we're not only not foreseeing this being feasible now, it'll be maybe a couple of decades before it is. But we do have, the thing is that when we're talking about these 9 cancers that are associated to HPV, the kicker is that it could be asleep in your body for up to 40 years before you're going to know it. So we could be contracting it now. It stays asleep in our body. And then you'll wake up years from now and you'll be diagnosed. You'll feel not well. You'll end up going to the hospital. You'll end up having tests done, and then you might be diagnosed with a stage 3 cancer. And a lot of people with penises, there's a very large link with head and neck cancers, tonsil cancer, any cancer above the shoulders is called an oropharyngeal cancer. And it seems to be affecting people with penises much quicker than it is people with vaginas. So we have a solution. So I've just given you a battery of bad news.
Well, let me jump in and ask this. Is like, so it doesn't live in the blood or have antibodies in the blood that could be tested?
No, it doesn't work like that. So that's why when you mentioned COVID, what are the comparisons? As much as it's a virus, it's very easy to swab and see the results, through saliva or through superficial testing. Whereas HPV, the virus lives in the gynecological regions, and it takes a different battery of tests, which is why if you have a vagina, it's a very different scenario. We do have screening, but the focus we're a few decades into studying HPV. So the focus has been for the past 20 years on a very important cancer prevention tool. We have HPV vaccination. So this is something that, we're a high income country, but all of us are living in high income countries. There's parts of the world like low and middle income countries that have no access to vaccination, but the United States, Canada, the majority of Europe, we're over 300 million doses of vaccination we've given so far to date. And it's a highly effective and safe method to prevent HPV, which is why it's best given to people prior to, sexual introduction. But there is no upper age limit for this vaccine. You could get it, Anthony could get it, I can get it. It doesn't matter if you've been in a relationship for 20 years, because remember, you may have given your first, hand job to a partner at 16. And because it's below the waistline, we've used our mouth or our hands or other parts to touch. I could wake up years from now when I'm in my 50s, 60s with an HPV. So we have HPV vaccination, and that's really our go-to. That's why, as much as, we're like, why haven't they done this? Let's focus on what we can do about HPV. The prevention is HPV vaccination. And it doesn't matter if you've had a precancer or a cancer. There isn't a scenario that you can throw at me where vaccination is not a good idea, because the way the vaccine works, it's when you take it, it works like a little bit like a rain jacket. So that if you're ever in contact with another human being, even if you've had full contact with them, their bodily fluids and their skin-to-skin contact, it'll protect you from those strains. So somebody who's had an HPV, and like when we say 3 out of 4 people will have had an HPV, we're 3 on this line. Imagine if there was a 4th one. So it makes it that we're really realizing how prevalent it is. So the chances of me having a reinfection are very high. So that's why even if I'm 44 years of age, I can't say, okay, it's too late for me. And, the pharmaceutical companies that do testing, we do 3 phases, and to keep it very simple, when we say, oh, we're offering vaccines up to 45, we're not offering it just up to 45. We looked at it on a fully grown adult woman who's 45 and it was still safe, but it doesn't mean the day you turn 46, okay, no, the vaccine's not for you anymore. So it's really important to be promoting that information. And depending on where you live in the world, there's a lot of free vaccination programs in schools for kids. We have to stop looking at this like it has something to do with sex. It's a cancer prevention tool. We have 9 cancers that we can prevent because of the HPV vaccination. So let's focus on what is available, especially, for somebody with a penis. It can be very anxiety inducing to be hearing that you can't really protect yourself from HPV. So that's why, in a lot of regions here in Canada, up to the age of 26, somebody with a penis who identifies as gay or bisexual has free access to the vaccine. So before the age of 14, it's done over 2 doses over a 6-month period of time. And after 14, it's 3 doses over 6 months. And it ranges in, speaking Canadian dollars, it ranges up to about $200 a dose. But a lot of private insurance providers will reimburse for vaccination if they fit outside of the program. So I just throw a lot of information at you, but I feel like, if we get to the very basics, being sexually active is as natural as breathing, eating, and sleeping. So, I feel like the biggest message people need to understand is that HPV has something to do with everybody. Nobody can wash their hands clean and be like, you know what, that's for the young ones. That's for those ones. I've been in a serious relationship for the past 25, 35 years. So this has nothing to do with me. It's like, sorry.
Right.
No, unfortunately, it does have something to do with you. But, the good news is we do have ways. I'll say it now and I'll say it again at the end, but at www.hpvglobalaction.org, you can come to our website, ask questions. We have a lot of visitors from around the United States. We get a lot of inquiries.
Very, very interesting. And so just my brain was kind of going towards wondering, so you did say there's like over like 180 or something, strands, and a handful of those create the 9 or have the potential to create the 9 cancers. So
Right.
if you were to get the vaccine, would it also like halt any viral HPV in your current system to maybe at that point prevent the future potential cancer?
So that's an excellent question. And then we are looking at that right now. There's a lot of research and it's looking at that. And we're tempted to lean towards the idea that it's going to protect you from further risk, but it's also possibly going to contain some of the damage that current strain is doing on your body. So it's not, it's accurate to be in the mindset of thinking, will it help me with my current status? So I think that's definitely true that if you or a partner were to be diagnosed with an HPV that led to genital warts or one of the 9 cancers, your go-to would be to be vaccinated, even if you've already been exposed, because it puts you at higher risks to be exposed to other strains, in your lifetime. So that's probably also the other gateway to knowing you have an HPV. If you're a partner, is to get a diagnosis of HPV cancer or genital warts. You can guarantee that you also carry that strain with you. So if somebody is aware that they have a strain, if they do have a penis, it would definitely be, to follow your healthcare provider more closely so that they catch you earlier. People that are diagnosed with a stage 4 cancer, it's much more difficult to contain it than it is a stage 2 or a stage 3 cancer. So I would say either a partner being diagnosed or yourself, it's definitely, and even somebody who's already been treated, oncologists, they're very busy focusing on your current status. They're dealing with the current cancer. And some are not taking it a step further and also prescribing the vaccination. And we are recommending that even if you have a cancer or a precancer, it is a very good idea to get the vaccine for the reasons that I mentioned earlier.
Yeah. And I would just also kind of think, well, if you do have a known compromised, health, doing what you can to ensure that you're not adding more stuff onto your immune system, right?
Exactly.
Because if your body is now trying to fight this new HPV that maybe is newly acquired, while you're also doing something else, that just means the body's having to work even harder, and thus probably reduces your ability to heal of any, of the other things. So yeah, that's that. Well, it is a lot of information, but of course, what's so great about these is people can rewind, listen again, and really have this information kind of sink in. So so there again, hearing, unfortunately, with males, there's no testing capability right now. Nothing else prevents it. So all my gay men out there on PrEP, no, PrEP does not have anything to do with this. That's like, saying I drink orange juice, so therefore I have enough water every day. No.
Right. Yeah. PrEP is HIV. HPV vaccination is how we prevent HPV. So, I've gotten in the habit of saying, we have an HPV pandemic, something that's pandemic. We can say that when 75% of the population has something, it is definitely pandemic, and it is even more, it's, our modern day biggest problem. It's even more contagious than HIV because of that skin to skin contact. So I think we need to be calling it for what it is, because it's, but like you're noticing right now, you said it, like you might have to rewind, re-listen. It's difficult to put this in a soundbite or in a 30-second commercial on TV. And we're sometimes making the mistake of focusing on, oh, this is something for girls. And a lot of people are like, oh, well, I thought this was something that affected just girls.
That's what I mean. I didn't realize, and just through lack of, awareness, that HPV causes the genital warts, and all the other cancers. I've never heard of that. I've always heard of cervical cancer, right?
Exactly.
Connected with HPV, not the others. And what's interesting to me is I think probably the lack of kind of the awareness and the push within the medical community to make people aware about those, potentially life-threatening cancers that could happen in 20, 30, or even 50 years from the time you contracted it, is because it's not that immediate urgency. Like, oh, I got HPV. Oh, if you don't come in and get, this shot, you're going to die in 3 months, right? There's not that kind of a sense of, like with COVID, since we're still in that pandemic, that has more of an immediate kind of, manifestation, where this seems to be a much potential longer, as you indicated. It could be, you could even have it and show absolutely no symptoms and still be a carrier, etc.
And you're giving it to, yeah, exactly. And, I remember when Anthony and I, were discussing at the very beginning, and he had such a link with, the community, all the different communities. And he was like, we really need to be sharing this information because, in all of these different communities, word travels. So it's really important to get good information into different communities, different demographics, so that you can be like, hey, guess what? Did you know this? And it's a very simple, linear message to be like, there's a vaccine. We have a vaccine. It's safe and effective. We've given over 300 million doses around the world. And it's proven to be the safest method to either prevent further damage or further contamination or even introduction. So anybody with kids in school, we should consider ourselves lucky that all you have to do in many places is sign a permission slip and your kid goes to school and they're going to be vaccinated while they're at school. Now, it's not a mandatory vaccination, but it's hard to refuse the idea that what's your good reason for not wanting to prevent 9 different cancers? Because people who say, oh, I don't like needles. Oh, yeah, you don't like needles? Well, try dealing with a case of genital warts, because the treatment for genital warts is you got to flip that penis up on the doctor's table. Then it's if you have them on your penis or on your anus or in that area. And then they have to individually be burned one by one. So there's pain, there's scarring. And then you got to go back every week for several weeks. And that's just to treat that flare up. So what do you prefer, the pinch of a needle or the treatment of genital warts that is going to come back over your lifetime? So that's pretty much, an end.
It's a no-brainer to me.
Well, for some people there.
Anybody with a penis listening right now is going to prefer that little needle to the individual burns of the genital warts on whatever area they're going to find them on. I can guarantee it is a no-brainer. It really is.
It's definitely, I think we spend a lot of time, but there's also, there's parts of the community that have a cervix as well. So I think that we should be clear that people that do have a cervix, there is what we call cervical cancer screening. So we have different degrees of ways of doing either through a pap test or an HPV test, where we use a speculum. A woman goes to, or a woman or a male or somebody with a cervix, because I think we have to be really careful that just because I think we need to take labels off and really focus on body parts for this topic. So somebody that has a cervix, they can go to their healthcare provider and have an exam where they put a speculum in, they take a sample, the sample gets put in a baggie, the baggie gets sent off to a lab, and at that lab, if it's a pap test, it'll check for those abnormalities, or if it's an HPV test, it'll pinpoint if you have one of those high-risk strains that are associated to a cancer, and then they'll either treat it or they'll follow you closely so that you don't end up like my best friend, because by the time my best friend was diagnosed with cervical cancer, it was really too far gone for them to deal with it and treat it. So this is why people with a cervix should be getting a pap test starting in their early 20s. Everywhere it's a little bit different. Like in Canada right now, the age is 21. I'm not exactly 100% sure the date in the year for people with the cervix, but it's probably between the age of 21 and 25 that we go for our first cervical cancer screening. And then it's usually 3 to 5 years after that. So I look at it like it's like a car. You got to get an oil change on that thing. So if you have a cervix, you need to get it checked out from time to time. Especially we're using it, we need to be screening it. So I think we have to be very clear that it's the 21st century and cervical cancer doesn't need to exist anymore. We have the prevention tools to make it that we can actually eliminate cervical cancer. So that's a really important message for people that do have a cervix, to really maintain that through vaccination and screening, we will be able to eliminate cervical cancer.
I think something that's really important for your listeners to know, that if you do have a cervix, that there's another test out there that's called the HPV test, that I think it's important to understand the difference between cervical screening through pap tests and cervical screening through HPV tests.
Yeah, it's a good point, Anthony. I think, first, it depends on where you live. In Canada right now, we have universal healthcare. And so we're offered a pap test. And a pap test is really, looking at those abnormalities. And then if they see, it's designed to detect a fog. The pap test was created in 1940. So we can pretty much all agree that's old technology. So once there's an abnormality found, they will do further testing afterwards. So it's very archaic. Now we've made a lot of advancements, and now we offer, I know in the States they do co-testing. They do a pap test and then they do an HPV test simultaneously. So to kind of, it's a way of double looking at, if there's any damage. And then a pap test, the difference between an HPV test, it's all the same thing in the sense that we're looking for HPVs in the gynecologic area of somebody with a cervix. So the HPV test has been designed to really detect those markers of those strains that are linked to one of those 9 cancers, or a variety of cancers. And then if you have that, so it's performed exactly like a pap test. We still take a specimen. It's done the exact same way. And then they put the specimen, they look under a microscope, and then it'll give you 96.1% accuracy, which is, any better than that, there's not much better than that. And it's really designed to detect with certainty a high-risk strain that will lead to a cancer. So this is for people with a cervix over the age of 30, because oftentimes under the age of 30, people with a cervix will clear a strain. So this is why our body, on the 180, many of them we'll get rid of, we'll never know we had them, they'll never be a concern for us, for the most part. But I don't like wasting my time talking about things that are never going to be a problem. So let's focus on what's the problem. So a persistent strain is one that will end up probably being a cancerous strain. So that is why the HPV test, if you live in an area where you're covered by it and you have access to it and you are 30 and over, I strongly recommend that you get an HPV test, or ask your healthcare professional. And in Canada, it costs $100. It's not free. We're working
and can you just ask for this, or are they going to offer it to you? Can you just ask for it? How does that work?
You absolutely have to ask for it, because it's not, a healthcare professional cannot provide you a service that comes with a cost. They have to provide you what's available through your universal healthcare in Canada. So you would have to ask. And then, sometimes it turns into a debate, and you're talking to a secretary and she's like, oh, you mean the pap test? And you're like, no, I want the HPV test. And then they're like, well, we don't do that. So they can order it in. There's a large, when we talk about HPV testing, it's a really large topic, because it's not fair to say you have to know this information on your own if you have a cervix. But unfortunately, we're still at that standpoint, especially in Canada, where you would have to be informed yourself, advocate for yourself, and ask your healthcare provider if they will do the HPV test instead. But the turnover time is you have the results within 10 days. So I can't emphasize enough how much better it is than the pap test, which is not always accurate. There's false positives. It will not give you a certainty of what you exactly have. And it isn't.
And the audience here on OutBüro and on the website is global. And, so I really just strongly recommend each and every one of you take a look at whatever healthcare plan you have, whether that's an employer plan, a self-employed entrepreneur, business plan, whether you're on Medicaid, Medicare here in the United States, or some other similar, social medical system like Canada, like Germany, and so forth too, and do know your rights. I mean, that's why I, had these great people on here, is to educate you, the audience, about this topic that I myself did not know probably 90 or 95% of what we've just talked about here. So I'm pretty sure you listening and watching this right now also didn't know. Maybe lucky if you knew 10 to 20% of it, right? And so that's why we've had the HPV Global Action wonderful folks here on to make you aware of this. And, as they were saying, getting the vaccine at any time is preventing the future, and or potentially lessening the potential of things forming in the future from cancer and so forth. But the studies are still out on that. So don't come back and say, oh, Dennis said, well, I'm not the expert. That's why we love to have folks like the HPV Global Action nonprofit here to talk about this. Well, I know we're going to be coming up here on our scheduled time, and it sounds like you guys definitely have a lot of work ahead of you. So have we maybe not chatted about something that you would like to share with the audience before we go?
I'd like to add something about, you said something that's really important about people getting educated, asking questions. And I remember that as soon as I realized that as a sexually active gay man, it was important for me to get regularly tested for STIs. I knew it was important, but it was very overwhelming for me to know whatever it is that I had to know. So that's why organizations like this exist. It's there to answer your questions, to ease your discomfort. So I think one of the messages that I'd like to give your audience is that if you're ever unsure about something, ask for help, ask questions. It's a very easy way to contact our organizations if you want more information on HPV. Do it. I strongly encourage you to ask questions and ask for help.
Well, absolutely. And we'll have the links down and below.
And I think one of the other things that I think is important to talk about is the way that we talk about HPV and prevention, the language that we use. Teresa said it before very well, that we're inclusive in everything that we do. And I think it's important to understand that when you're doing interventions like the ones we do, the language that we use has to be inclusive as well.
Very good. Very good. And I liked you correcting me, Teresa. It's not male or female, it's penis and cervix. So thank you for that.
I'd like Teresa to talk about that, because there's a very good reason why we speak about things the way that we speak about them.
It doesn't matter if the person has a penis or a cervix, how they feel about themselves and how they live their sexuality. It could be a large array. So if I only speak to, one type of person, that other person the entire time is going, you didn't mention me, so this probably doesn't have anything to do with me. Mm-hmm. And in every community, in every room, in every classroom, in every platform, I believe that there is a diversity. There's a whole cocktail of types of people that are there. And I think that making sure that people understand, regardless of what sex you are, what gender you identify with, how you live your romantic life, and who you're attracted to, you throw it all in the blender and know that regardless of where you fit on that spectrum, HPV definitely has something to do with you. And that's the part of the message that I hope that will have definitely come through today is that where, you either have a penis or you have a cervix. You're one or the other. And I think that, knowing that there's a prevention method, regardless of how you identify, is definitely the way to making sure people understand clearly that this is something they need to pay attention to. And then, hopefully they'll feel empowered so that regardless of any type of bias or difficulty they may have bringing that to a healthcare professional, because I do have a full understanding and appreciation that not everybody is getting equal treatment and they are made to feel uncomfortable sometimes by their healthcare professional, or it's an uncomfortable process regardless. And we all have our own reasons. I may have had a negative experience. I may have been, assaulted in my lifetime. I may have lived regardless of my sexuality. So we all have to realize, the world is a big round place, and there's a lot of types of people that are in it. So keeping messages fluid about how important it is to be preventing HPV, this pandemic that we're not talking about, is really the way to go to make sure, like you had said earlier, you thought it was just about girls.
Yeah. Well, and you mentioned it's currently 75% of the people, and it's just contact with that. So you're one example of, even if you just gave someone a hand job or played down there with your hands, now you have it on your hands. It doesn't even have to necessarily on you be between, in the swimming bathing suit area on you. So I think that is a very important distinction and information that you gave there, because they might think, oh, well, we didn't have sex, so therefore I'm not going to get it.
Sexually active, people think you have to stick your equipment into somebody's hole to be considered sexually active. But that's why I always have the lingo of, you're sexually active the minute you go below the belt, with your hands, your mouth, with skin-to-skin contact between the waist to the knees. So being sexually active, a lot of people are not under the impression that a skin-to-skin contact is considered to be sexually active. And why it's so important to not forget is because we do come into contact with other sexually transmitted infections when we do have skin-to-skin contact, unfortunately. So I'm hoping that, this message goes far and wide. And if you ever want us back to do a part 2, or, we're very, the more microphones we have, the better. We try to have a global audience to really be promoting simple, clear information, so that, we just threw a lot of things at a lot of people, including yourself. And right. I think it's important to keep the message rolling and spread this awareness as much as possible.
Well,
I would encourage anybody, if you have any questions, Dennis, if you get any questions from anybody, please don't hesitate to get them to us. We'll be happy to answer.
Well, we'll definitely have links to your website in the show notes. So everyone listening, you can scroll down into whatever application that you're watching or viewing this on, and we'll have a link there directly to their website for more information and whatever format that you have for questions. And well, gosh, this has been such an enlightening conversation. I so much appreciate you both taking time out of your day to come on and share with us.
Thanks for having us.
Well, it was a pleasure, Dennis. Thank you.
Awesome. And thank you, everyone, for staying tuned to this very informative conversation. I hope that you've learned something today, like I have as well. Be sure on whatever application that you are watching or listening to this to, that you go ahead and smash that subscribe, like, and follow button. If you are watching this on YouTube, also be sure to click that bell. That's a notification bell, so that when new episodes come out, just like this and so many more, you will get a push notification right when you launch your YouTube. We thank you again for your time, and be sure to come over to OutBüro.com, where you can view these episodes and our current catalog of over 90 other episodes. When you do join, be sure to complete at least 30% of your professional profile, which will unlock all the features such as connecting/friending with others, direct messaging, and there's currently over 240 groups. If you are also listening to this and want to learn another language, OutBüro, all text on OutBüro outside of the community forum is automatically translated into whatever your browser chooses. So you can view OutBüro in German, Spanish, Tagalog, Farsi, and so much more. We look forward to seeing you there. I'm Dennis Velco. Bye-bye.